Hmm.
And we're off. Welcome back to Live with Jane and Jody on Tuesday, June 11th. We are going to have a fantastic conversation this afternoon with Dr. Tara Peyman. But of course, before we get started, we're going to do some quick introductions and the formal housekeeping. Of course, everybody, we are recording this session. We'd love for you to turn on your cameras, unmute yourself, stay involved in the conversation, and join us. These sessions are for you guys, so we really want your questions and your involvement here in the conversation. For those of you that don't know, my name is Jane Voorhees. I'm one of the admissions representatives, of course, helping candidates get ready to be enrolled here at Sonoran, getting ready for a successful interview experience. I work with the candidates whose last names are M through Z, and you'll meet my partner in a moment. Jody helps A through L. But ultimately, yeah, I absolutely am honored to be a part of this community, helping you guys grow into amazing doctors like the one that you're going to meet today. Outside of Sonoran, I'm still a live entertainment junkie. I went to a concert this week. Like, just send it my way. Sports, concerts, whatever I can do. I love to be out there and enjoying live entertainment. So enough about me. Hello.
Yep. Thanks, Jane. And like Jane said, I'm Jody. So I work with the beginning of the alphabet. But like Jane, we have the same mindset. We have the same goal. We absolutely love what we do. So it's great working with somebody that has the same goal that you do. I actually have been with Sonoran in August. I'll be celebrating my 18th year. Absolutely love what I do here. Love helping the students. I'm so excited. Monday is one of our graduations, so I love attending that and seeing the students that we sit and talk to just like you right now. And then in just a couple years, short years, you'll be graduating. So welcome. I hopefully you enjoy everything Dr. Peyman's got to say. She's going to have some great information. Um, Let's see, what else do I go? Originally from South Bend, Indiana. I've actually been out here on Saturday, will be my 22nd year. So absolutely love Arizona as well. So you guys, like Jane said, these are for you guys. So feel free to ask the questions. If you want to put your question in the chat or you just want to unmute yourself and ask questions, this is for you guys. So welcome and have fun. Awesome. So as you guys know, I always share a core value. Core values are beliefs of our institution. Today, I did choose we are resilient. And by never giving up, finding solutions, we achieve excellence through tenacity and teamwork, through appreciative inquiry, identifying our best practices to overcome challenges, through wellness, promoting physical, mental, and emotional health, with mindfulness, finding calm in the face of adversity. So I know that that's one of my favorites. We are resilient. So, all right, guys, enjoy.
Jody, I don't think you realize how perfect that core value
I
is
know I
with
was reading it before I came on.
with graduation on Monday.
Mhm.
Here's the key element in this whole factor is the class graduating on Monday was the first class of COVID. These guys
Mhm.
started in spring of 2020.
Yep.
Like they were about to start in March of 2020 and bam, the whole world shut down. So
Yep.
talk about resilience.
Yeah, I know. I know. I know. I
Yeah.
thought it was perfect. I know.
Awesome. Very good. Very good. All right, guys. Well, let's move on to today's wonderful guest that's joining us, Dr. Tara Peyman, of course, the graduate of Sonoran University, graduated when it was Southwest College of Naturopathic Medicine in 2007. Prior to her journey to Arizona, she was born in Canada and moved to Connecticut at an early age. So that's where she calls home. But I'm sure Arizona was a good relief from the chili. So she received her bachelor's degree from Antioch College in Yellow Springs, Ohio. She designed her own major in health and human development, which was a combination of psychology and biology. And that's just fantastic to know what you want and build it.
Right.
Her hobbies consist of meditation and mindfulness practices. She belongs to a Buddhist studies meditation group, and she enjoys painting, practicing yoga, and spending time with her husband and young daughter. Thank you so much for joining us today, Dr. Peyman. Anything you want to add to that intro?
No, thank you. I guess the only thing that sort of comes to mind when you were talking, Jody, about, living here as long as you have, I have recently come to recognize that even though I grew up in Connecticut and then, went to college in Ohio, spent a few years there, I've lived here the longest that I've lived anywhere. So
Nice,
really, I've
nice.
lived here for 21 years now. So
Okay.
really, Arizona is really what I consider home. And my family doesn't live in Connecticut anymore, so I never go back there.
Yeah.
Okay.
Moved to Maryland
Okay.
when I was at SCNM. So and yeah, so like this is really my home and I've grown to
Awesome.
love it.
Awesome.
Arizona. Love that.
Yeah.
It's kind of like we drink the punch or something and you just
I
can't get
know.
away.
Yeah.
I
Yeah.
know.
My
Cool.
husband is really big into nature. And so, and
Mm.
then when we first started dating, I was like, I want to move out of here. And he was like, just wait, I'm going to show you how beautiful this state really
Yeah,
is. So
exactly.
he got me hooked. I
Exactly.
was like, oh my gosh,
Yep.
you can just get up into the
Yep.
mountains, get out
Yep.
to the ocean. It's really not.
Such a
Exactly.
variety.
Yeah.
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 Yeah, I wish we had
So
oceanfront
much.
property, but yeah,
I know.
yeah.
I know. Awesome.
The
Awesome.
rivers
Yes, I
help.
love it. I
Yeah.
love even when it's hot like it is, it comes earlier and earlier every year, but it's like I can't imagine living anywhere else. I love the sunshine every day. I love it. I love it. Love it. So, and we still have family back in Indiana. So we go back and visit. I have a daughter that lives in Kentucky. So we're heading there the week of July 4th. But you know, home is Arizona.
Yep.
You're absolutely right.
For all of us.
Awesome, awesome. Well, I'm just gonna dive right in here. So I always start the conversation, Dr. Peyman, with how did you become interested in naturopathic medicine? Where did your passion come from?
I have always been interested in helping people. I noticed, looking back when I was in high school, even in middle school, but especially starting in high school, I started getting interested in like herbal medicine and massage therapy and like different ways to sort of heal and help people. I was I picked up a book my mom had from like the 60s, like an old hippie book about herbal medicine that was sitting on our shelf when I was in high school. And I flipped through it. And then I went to the health food store, like a sort of a version of Whole Foods. And I got these like bulk herbs and empty capsules. And I carried them around in my backpack, like just in case a friend had a headache or a stomach ache. And I would
Oh,
like make up a
fun.
little capsule and be like, try this. And so thinking back, it was really clear to me that that was always sort of part of my
Hmm.
curiosity and something that I always was interested in doing,
Wow.
helping people and using natural medicine. And then and so I went to college and I never knew about naturopathic medicine until I was about to graduate. So I developed my own major, just taking classes that I was interested in. Ended up being about half biology and half psychology. And I was particularly interested in the way that people develop over time, like from childhood to adulthood, and the way that we either get sick or stay well, and the sort of influences in that. So that's what I was looking at. And then when I was about to graduate, I met with my academic advisor, and he was asking me what I wanted to do. And I said, I probably want to go to grad school for nutrition because I'm interested in, like natural medicine. And I think that would be good for me. And he was like, oh, I thought you wanted to be a naturopathic doctor. And I was like, what's that? And he showed me at that time, there were 4 accredited naturopathic colleges in the country. And he showed me all of them online. And I was like, ooh, Southwest College in Arizona. I had always been attracted to the Southwest. I have no idea why. When I
Wow.
was when I was in high school, I cut out this picture from a magazine of like a desert and these like models sort of standing in like a rugged way in the desert. And I was like, that's so cool.
Oh,
Anyway,
sweet.
it's sort of silly, but I just was
Fun.
attracted naturally to that. And so I was like, that is where I'm interested in going. And I looked at the prereqs, and it was every single class I had already taken just by taking the classes that I was interested in and designing my own major,
Neat.
except for one organic chemistry 2 class. And I was like, that's
Nice.
it. I'm going.
Nice.
I
Meant
didn't
to
even
be.
apply anywhere else. I just
Wow.
took that extra organic chem 2 class over the summer when I was still at college. And I applied to SCNM. I remember walking in the doors. I don't know if either of you have had this experience anywhere, but where you like walk in somewhere and you get this feeling of like, I'm home.
Yep.
That was the
Yep.
feeling I had when I walked through
In
the door.
that original AB building, the flags
Yep,
hanging
the
there,
flags.
all of that
Yep.
feeling.
Yes,
Oh,
I had that
Yeah.
feeling and I was like, this is it. It's going to happen.
Yeah.
And so I interviewed and I got in and I was like, all right, I'm set. I'm on the journey.
good for you.
And that's what we tell our students, Jane and I both, is, talk to all of the schools, get a sense of what all the schools offer to you, but the school that you're attracted to, you will walk in and that's where you belong.
Yeah.
And you'll sense that. Yeah.
Definitely had that.
Awesome.
That's
See, you're
so
proof.
cool.
Yeah.
Yeah, I got the goosebumps because
know,
I
so
have
did
that
I.
same moment right here on this same campus. I know exactly what you mean.
Yeah.
Just an incredible energy when you find it and you know it. Yeah.
Yeah.
Oh, that's so cool.
Absolutely.
And that was going to be our next question. Did you apply to any other schools or why did you choose this? But yeah, that
it was
moment.
just meant to be, it feels like.
And how perfect, like you really, again, just that knowing of this is what I want, this is what I'm going to accomplish, picking those classes, laying your own foundation out there. So you never really, had you been considering an MD or a PA or anything along those lines? It was just
what? No.
nutrition.
I had this impression that medical doctors were like, I was like, no, like I don't want to do that because I thought like I was specifically not interested in just doing like drugs and surgery.
Right.
I was like, no, I want to use some kind of natural medicine. I mean, honestly, I was thinking after I graduated high school, before I even went to college, I remember talking to my parents about maybe going to massage therapy school because I was just interested in like getting out and helping people. And I always sort of liked that hands-on sort of thing. And my dad was like, please go to college. Like you have a lot of potential. I feel like it would just open up your opportunities for more things. And he actually, bless his heart, he went to the library because this was like pre-internet. And I'm kind of age checking myself right now.
I remember those days.
Yes. So he went to the library and looked at a huge book of colleges, like all of the colleges, and he found Antioch College, which was one of the colleges where you could do a work study program. Because I had this interest in like getting out and doing things. I didn't just want to study for another 4 years. I wanted to start sort of actively trying different fields out in the world. And so they allow you to do that, where you can do internships. It's not just they like require you to do little 3-month internships, kind of experiment in different working, fields. Brilliant. And so I got to test out, how I got to work in a like a research lab at Yale University, which turned out I didn't like at all. Like I realized then, like, okay, I like science, but I need to work with people. I can't just work with like cell cultures. So that's information. I worked in like a social work type position with HIV positive women. And I was like, that's a little exhausting. I mean, it was a pretty intense position and I was really young. So now I think I would do better with it. But I was like, I don't know if I want to do that. And then my favorite one was running the wellness center at the college. It was like an on-campus job.
Nice.
That's what I love most. It's like running a little clinic kind of thing. And I was like, oh, interesting. So then when I learned about naturopathic medicine, I was like, that sounds like something I could do.
Okay.
Yeah. Perfect fit. And it was your advisor at Antioch that actually was not until almost your 4th year, but hey, by the way, I thought this was your plan the whole time. That's so funny.
Yes. I was like, why didn't you tell me this?
Earlier.
Yeah.
Wow, lucky. Awesome. He had it up his sleeve. He was just watching you develop.
Exactly.
Waiting for the right time.
Awesome. So, Dr. Peyman, did you do a residency at all? And if not, or if so, can you tell us why?
Yeah, I did not. At the time that I graduated, or I was about to graduate from, at that time, SCNM, I was asked to apply for the residency. There were a few of the doctors that I had worked with in clinic wanted me to apply. And I decided I really didn't want to continue doing general naturopathic medicine.
Okay.
By the time I was about to graduate, I was fully sure that I wanted to do mental health and homeopathy.
Nice.
It wasn't like ambivalent. Like I was completely clear that that's what I
Yeah.
wanted to do.
Wow.
And I just didn't want to spend any time not doing that anymore.
Okay.
I have a chance to get out and start doing what I am passionate about. And yeah, I just didn't want to like supervise prostate exams and mole
Sure.
removals. And I was like,
Okay. Yeah,
no, thanks.
absolutely.
However, I know that it would have helped me, of course, like doing a residency always helps a person. And as far as I've heard, one of my best friends, when I graduated, ended up doing the general residency, and then she created the homeopathic residency as well.
Oh,
It wasn't
okay.
a thing until like when I was about to graduate, it didn't exist. And then
Ah,
Natalie Ham, I'm talking about, was the one who
Yep.
damn. Okay.
Dr. Ham.
created the homeopathic residency. So if that had been there
Mhm.
already, it might have been inspiring to me to do the general residency and then do the second year as a homeopathic resident, because I was so interested in homeopathy and I would have loved to learn, more hands-on from Dr. Messer at that
Yes,
time.
Right.
that's who was coming to
Oh,
mind. I'm sure it was Dr. Messer.
yeah.
Like, wow.
Yeah.
Yeah. Big
He's
influence.
still an amazing mentor to me.
Yeah. Oh man.
Yeah.
Just incredible. I lost my
Yeah.
train of thought. Thinking of Dr. Messer suddenly, it just popped in. I remember
Yeah.
him too.
Mhm.
So you, like you said, you were very clear. I want to do homeopathic. Like I know where I'm going. So you started your own practice. Did you do a joint practice? Like you began
I
right off the
never
bat?
started my own practice until later. I joined a group practice. So as an
Mhm.
independent contractor, a friend of mine was also in the same kind of situation where she could have done a residency, like she would have been very good at it, but we both were interested in just jumping in and getting started. And we heard that there were openings at this clinic out in East Mesa. And it was actually with one of our old teachers, Dr. Jennifer Nevels, who
Oh, okay.
she had an opening, 2 offices that were open in her practice. And so we started practicing there as independent contractors. And then I continued there. So I was there from 2007 until 2011, I believe.
Okay.
But then a year later, I I felt like I wasn't getting I wanted more mentorship in homeopathy, and there weren't any doctors there that were really focusing in that, other than my friend Carrie, who was like the same level as me. So I was really wanting to have more experienced doctors that I could go to, to say like, hey, I need help with this case, or what do you think about this? And because I really value that, I think that's really important for every doctor to be able to have
Right.
that, consultation and the more easily available it is, the better, in my opinion.
Absolutely.
And so Eric Udell and Denise Haller at
Yeah.
Arizona Health Center had an opening at their office. And so I talked with them, and I joined their practice as well. So I was actually working in 2 locations, and then my Tempe location with them started growing. I don't know if it was because that was where my passion was, probably, honestly,
Right. Right.
or if it was like other circumstances, but that practice grew and the Mesa practice shrunk.
Sure.
And so I increased my days in Tempe and decreased my days in Mesa. And then I ended up leaving the Mesa office a few years later, and was just in Tempe at that group practice until 2014. And then I moved up to
Okay.
Scottsdale with a friend of mine, and we joined a different group practice. Then we had kind of a vision of joining a practice that was really psychology based, because instead of like the practice, Arizona Natural Health Center was all homeopathy based. Like everyone who was there did
Mhm.
homeopathy as the primary modality. We would all do other things too, but everyone was doing homeopathy. And we each had our own kind of niche. So I was the mental health homeopathy doctor, and then we had a doctor doing oncology, a doctor doing like autism spectrum, developmental disorders. We had a doctor doing women's medicine. That was Natalie Ham. Um, Eric Udell was doing like autoimmune disease. Anyway, so everyone had sort of their own little area of expertise.
Wow.
And then what I started to kind of crave was a practice that was filled with people that I would need to refer to and would need me, So that would be like a practice with a psychiatrist, a psychologist, different types of
Modalities.
practitioners that we're all working kind of collaboratively, potentially, to help kind of a one-stop shop concept.
Yep.
And so a friend of mine who's also a naturopathic doctor, she and I joined another practice in Scottsdale with that intention, and we were kind of creating that, and then that didn't end up going in the direction that we really needed. And so we decided to open our own clinic called Integrated
Nice.
Health Center, and we opened that in 2015. And so that's where I've been since. That's the journey.
Okay.
There it
So
is.
almost 10 years.
Yeah.
Awesome. Very good. So it's just you and another naturopath?
So
The two
now
of
it's
you?
changed so much over the years. So
Yeah.
we've had so many iterations of it. We had multiple naturopathic doctors. I don't know the total count, the max count, maybe 5 or 6 at the most of naturopathic doctors. We've had a psychiatrist, we've had multiple therapists work at the practice, a psychiatric nurse practitioner, just in and out over time. And now it's landed at, we've sort of expanded and then whittled back down. So now it's a group of just 3 of us, just naturopathic
Wow.
doctors. And so
Okay.
for the psychiatric medications, if we need to manage those or have our patients who are taking antipsychotics or things that I can't prescribe here in Arizona, or, stimulant ADHD meds or something that they're already taking that they're benefiting from, then we just have a huge network list of psychiatrists or psychiatric nurse practitioners or other prescribers that can help us out.
That you can
Collaborative.
refer to. Okay. Okay.
And
But you
therapists.
still, your main modality though is your homeopathy there.
Yes, that is our primary modality. We do a lot of other naturopathic medicine as well, like herbal medicine, nutrition, and IV therapy and acupuncture. And I'm not trained in this, but our other 2 doctors are trained in craniosacral therapy. So we do offer
Okay.
a lot of different modalities, but all of us do homeopathy for pretty much everybody. Yeah, we find it just to be so effective and so gentle and yet very profound in its
So
effectiveness.
Dr. Peyman, for those on here that do not know what homeopathy is, can you give a brief description of what it is and how it works? And because I
Sure.
was very confused about homeopathy for many, many years.
Yeah, I think a lot of people are confused about it. A lot of lay people, who haven't been trained, think that homeopathy is the same as natural, that it just means the same thing. But anyway, for people who know at least a little bit about it, so it's difficult to explain in a super succinct way, but because there's so much depth of what I can get into. But basically, the concept is that it's nanoparticle doses of natural substances, mostly plants or minerals, that when given in these nanoparticle doses, stimulate the body in a variety of ways to heal itself, to correct imbalances that are occurring, that are dynamic, meaning that the body is capable of correcting the imbalances on its own. It just needs to be stimulated to do that. So for example, if you have a vitamin D deficiency and you have a disease because of a deficiency, you can't give a homeopathic remedy and then cure that. You need to give vitamin D, but if you have an immune dysfunction or depression related to an imbalance in the body for a variety of reasons, or a person is experiencing like a grief reaction or something where there's a dysfunction, but not a deficiency of something that the body doesn't have the ability to produce on its own, then the homeopathic remedy, if it's correct, if it targets the person's nervous system or immune system or whatever needs to be adjusted in just the right way, it can trigger this kind of act as a catalyst and trigger this reaction in the body to help rebalance, help encourage the nervous system or the immune system or whatever is out of balance to get back into balance. And then the beautiful thing about it is that unlike a lot of other even naturopathic therapies, I consider it to be one of the most true forms of real healing, because it doesn't just naturally kind of cover the symptoms, temporarily while you're taking the supplement, while you're taking the remedy, it actually encourages you to do the healing. Whereas, if somebody is, let's say, they're having depression and you put them on 5-HTP, then you give them more of that substrate to produce serotonin. So they feel better when that is in their body, but it's not teaching their body how to heal itself. It just kind of gives you a thing that makes you feel better while you're on it, which is really kind of similar to a drug. It may not be as harmful.
Right. Sure.
But it's not actually like encouraging healing. So there are a few things, other things, in addition to homeopathy, that do that within the naturopathic world. Like, hydrotherapy is one of those things, or other types of like detoxification protocols, getting rid of something that's blocking the person's ability to heal. That's another, it's, clearing the path for the body to heal itself, giving the body nutrition. I mean, that's sort of the same concept as like a detoxification from another standpoint, in the sense of like, if your body doesn't have what it needs to heal, you have to give your body what it needs to heal. It's just basic fundamentals. So anyway, that's kind of the
I just think it's amazing.
overview.
Yeah.
There's a really amazing book if people are kind of skeptical or curious about learning more about the science behind it. There's an amazing book, which might be unfortunately out of print now. Last time I checked, it was like ridiculously expensive. So I own it, so I'd be happy to like loan it out as long as I can get it back. But it's called The Emerging Science of Homeopathy, and it's by two MDs from Europe who just did a ton of research on homeopathy, and it's the actual like mechanisms of action. So then if you want to look into it more as well, or look at like the actual science behind it, Dr. Iris Bell is doing a ton of really excellent research on homeopathy and showing that it really does work. It's not placebo. It's, it's active in animal studies where there's no possibility of placebo. It's active in cell cultures where there's no possibility of placebo. So this is, it's real medicine. It really does work. There's an amazing film that's coming out called Homeopathy. I think it's called Homeopathy, the film, or something like that. Introducing Homeopathy. That's what it is. Introducing Homeopathy. And it's going to be amazing. We're hoping that it gets on Netflix. I got to preview it at the JAHC conference.
Wow.
So it's going to be really cool. Hopefully it'll change a lot of minds.
That generated several questions, and we even have a hands up here. So yeah, that was awesome. I love the key term that I picked up from you today is the nanoparticles.
Nanoparticles. That
like,
definitely
wow.
helps.
All right. That's going to help my pitch later on. So, all right. I see Suzette, you've got your hand up, and then we'll jump into questions here. Go ahead, Suzette.
Yeah, I just I was wondering, because you concentrated in such a particular field, like the combination of the mental health and the homeopathy. How did you find that Sonoran helped you concentrate on it? What did they provide for you to be able to concentrate in it? What the resources, what is it that they gave you?
Yeah, that's a great question. So when I was going to Sonoran, now, then it was SCNM, there were a lot of homeopathy shifts in clinic. The first thing was that I noticed when I was taking the classes in homeopathy, at first I was a total skeptic. I remember reading the Organon of Medicine, and you'll see, like, I haven't erased these little notes that I made in the side of the text. I was writing like, this makes no sense. Like, I don't believe it, and I was just a total skeptic. And then the more I kind of read about it, I was like, maybe, okay, I'll give it a shot. I'll try to be fair. The more I learned about it, I just was really interested. It was just curious to me. Like, it sparked a lot of interest. So that was something that I kept paying attention to throughout my academic time. And also once I started in my clinical internship, like when I was doing my clinical rotations, I noticed that the cases that were most inspiring, motivating, rewarding to me were the mental health cases. So whenever I got to work with a patient who was dealing with depression or anxiety or insomnia or some kind of mental health condition, PTSD, I was like, I like this. I felt like I could connect naturally very well. And there was just a level of like drive that I had that was different from, some of the other pathologies that we were working with. And so I just paid attention to that. That was the most important thing that I would suggest for anybody on this call, is to pay attention to what sparks that kind of level of interest. And because that could be an important niche for you. It would be easier for you to focus on something like that because you have a natural interest in it, as opposed to just choosing something and being like, well, maybe that, if you're not very interested, then your patients are going to feel that you're not that interested, and you're going to potentially get more burned out. So that was the first thing. I was able to take a lot of homeopathy shifts because that was available to me. And so I just started to do that. And the more I did that, and the more I noticed that I was really interested in the mental health cases, that was what really, motivated me to move in that direction. I mean, that said, during the academic portion, at least when I was there, I didn't feel like I got a massive amount of psychology training. Like, I got the foundations. I felt like I was I had, like, I was well equipped to start, but I wasn't really confident that I was like all set. Like, I'm good. I don't need to study deeply. Like, I jumped into studying deeply as soon as even as soon as I knew that I wanted to focus in mental health. I started getting books about, bipolar disorder, depression. I started reading like case studies and getting a lot of mentorship from other doctors that were doing the same thing. So I knew that I had areas of weakness, as a brand new doctor. And I wasn't going to pretend that I was an immediate expert or like that I knew everything I needed to know. None of us ever know everything we need to know. We're always all learning. Even, people who've been in practice for 30 years should always be learning. So, yeah. So, but I felt like I was sufficiently equipped as long as I continued to do that, lifelong kind of education throughout my practice.
Nice.
Just a quick follow-up. So if you were starting now at Sonoran and you knew that was your passion, well, I don't know how familiar you are with Sonoran right now, but can you tell me which courses or which area you would like to dig into, and really get into? It's like, oh, I really want to take this class with this doctor because he does whatever, mental health or I don't know. What do you find different now than in 2007 or 2004?
I would defer to the admissions people or whoever, because I don't know all of the details of the programs and everyone who's there now. I know it's changed a lot. So I would just talk with the academic, staff there and say, I'm really interested in this. Help me, find the right people that I can connect with. I would highly recommend, I don't know if they let students do this still, but when I was a student, they let you start kind of like shadowing in clinic, even before you were in like the normal sort of rotations. I don't know if that's
a student for a day.
So no, as a matter of fact, Dr. Peyman, the curriculum has changed so dramatically since you were here. Field observation is built into the whole first year. They actually start those clinical skills in field observation. They are observing either downstairs or in the field during their first year. It's actually built within. So that's beautiful to point to Suzette's suggestion. Yeah, pick the ones you want or whatever, or try a whole bunch of different ones.
Yeah. And then the other thing that you can do that a lot of, I've done a bunch of offsite rotations with students from Sonoran. So there are a lot of different doctors out in the field that, are not associated with Sonoran that are taking students where you can just sit in. If you already have clinical skills, you can start using them, like as, taking vitals or like studying cases. So I'll have students sit in with me and, they won't necessarily do a lot of the clinical work, but they'll just observe. And then instead of me, unless I'm really rushed for time, if I have enough time to do this, which I usually end up doing at the end of like a new patient consultation, for example, I will say, okay, we're going to go, review your case and do our analysis, write up a treatment plan, and then we'll be back in 5 minutes or something. And so the patient just waits in the room, and then I go back with the student into like our little waiting area or, some kind of side room, and we talk about the case. And so it's a great learning experience, an opportunity to see how things are done in the real world.
Yes, absolutely.
Thank you very
And Jody mentioned it. We are also now offering student for a day on Mondays and Fridays here. So there's different options, different types of shifts. Through the summer, we have mostly shifts in the Neil Reardon Center. So if you're interested in regenerative medicine, as far as clinic shifts, that's what we have through the summer. But there'll be a lot more options in the fall too.
Yeah.
Thank you, Jane.
Yeah, of course. Yeah.
Were there other questions in the chat that we?
Yeah, there's lots.
Go ahead, Jody.
Hold on, Jane. Okay. Let's see. So let's just start from the beginning, and hopefully if we've answered them, I forget where we're at. So why homeopathic for mental conditions? Is there something about homeopathic approach that make it particularly effective, suitable for mental illness? Good question.
Yeah. And then right after it says, thanks, you were answering this question. So maybe we already answered
Oh,
it, but
maybe we did.
I'll just
I'm sorry.
again, I mean, one of the main reasons is that I guess what I said before, it's like so gentle and yet so targeted. So I find it to be, really appropriate for a lot of these cases where, a person, a lot of the time people who are dealing with, strong anxiety or trauma-based symptoms or other mental health conditions are really sensitive. Like their nervous system is in, a fight or flight kind of mode. They're dealing with a lot of intense symptoms. And so I find that the right homeopathic medicine just goes right to that source of the problem. And it just sort of removes a lot of these symptoms where, adding sometimes I don't want to like talk down about like herbal medicine or nutritional supplements. Those are wonderful as well. And I use them, but without that homeopathic medicine, I feel like I just end up chasing symptoms sort of indefinitely because unless the person is doing really deep counseling and therapy and like undoing the problem, let's say it's like a trauma-based condition, if they're doing really good therapy, then that's healing, that can really get to the cause and heal it. But the addition of homeopathic medicine just can speed up that process and make it so much easier on the patient as well as on the doctor. Because if you can, find the right remedy, you're like, everything else just becomes so much easier. You don't have to add and add and add all these different pills, and it makes it so much easier for the patient. So they're not having to take, 10 or 20 different supplements and following these complicated regimens that a lot of doctors put people on just too many things, in my opinion. I think it's simple, it's more cost effective. It's so much more cost effective. That's a wonderful option for a lot of people because it's, it's like $10 for a month supply.
Oh yeah, it's
affordable.
I know I've had a homeopathy remedy for, I have a torn meniscus in my knee, and I've taken the homeopathy remedy, and it definitely helps. So, because you're targeting that area. And what did Dr. Udell always say? When I was trying to learn about homeopathy, I went to his office and I saw the thousands of bottles of homeopathy remedies he's got. And he always say, just remember like versus like. And I'm like, oh, that makes sense,
Yes.
So yeah.
Yes.
Yeah.
Yeah. I didn't mention that sort of phrase before when I was talking about what is homeopathy, but that is a really important foundational concept with homeopathy that you get. It's not just a random selection. The doctor gives a homeopathic remedy that in full strength, in like big doses, can cause a specific set of symptoms. And then in a patient, when a patient has those same symptoms, we don't give a big dose because that would make them sicker, but we give a nanoparticle microscopic, like tiny dose, and it's just enough to kind of mirror. It acts like a mirror to sort of say like, hey, wake up, you have these symptoms. You don't need to keep doing that. Like try this, kind of like stimulates the system to act against that. So it like pushes you in the same direction that you're already off balance, but it's such a tiny dose that you are actually stronger. So you push back and correct. So it's very targeted in that way.
Yeah.
I hope that answers your question.
It's amazing. Yeah, again, like it's good notes. It's great to learn and understand them.
Yeah. Along these same lines, I guess there was another new question. Is a range of mental health conditions for which homeopathy is effective? Is there a hierarchy of conditions related to effectiveness? So I've found that almost all mental health conditions can be treated with homeopathy. It's only the cases where the condition is not caused by stress at all. If the condition is caused by an abusive relationship, an amazing homeopathic remedy is not gonna.
Right. How do you,
Right. You need to get out. It's like being toxic, right? It's the same thing. Like if you're living in a toxic dump, if you're living in like a moldy home, for example, super toxic, like not just a little bit of mold, but like super toxic. Or if you're ingesting just constant, toxic food, or you're drinking alcohol and you're abusing alcohol, for example. A good homeopathic remedy is not going to cure that problem because you need to remove the toxic thing. However, a good homeopathic remedy for a person who's stuck in a situation like that can still help them to take the action that they need to take. So let's say they're in a toxic relationship and they feel stuck and they feel depressed and they feel, beat down about their situation. The right homeopathic remedy, I've witnessed this, can actually help them have the courage or have the clarity to be like, I need to get out of here, and then they take the action that they needed to take. But it wasn't until that action was taken that they finally were able to truly get well. And so it's the same thing with, toxicity. There's another mental health condition is anorexia nervosa. So that involves a lot of nutrient depletion by nature of the condition. So an amazing homeopathic remedy can help a person to feel better to some extent, but if their symptoms are related to nutrient deficiency, then you can't treat that purely with homeopathy. They need nutrition and, counseling and, sometimes inpatient treatment as well. Certain severe psychiatric conditions like severe schizophrenia or very severe bipolar 1 disorder, schizoaffective disorder, which I work with a lot in my practice. Most of those cases, I recommend that we use a combination approach where most people just do best if they're taking at least a little bit of psychiatric medication to help support their brain function, to kind of keep things more stable. So we keep them out of the hospital and we keep things more, calm and functional. And then the addition of the right homeopathic medicine can be extremely helpful. But most other conditions like bipolar type 2, PTSD, anxiety, depression, panic disorder, all of these things I treat all the time. And then a lot of these conditions come along with a lot of physical symptoms like IBS or, sleep problems or migraine headaches or PMS. Like a lot of things are kind of related. The body is not just separate. We're not like a machine with separate parts that don't talk to each other. So there's a huge connection between the gut and the brain. We're learning so much about that. So we know that it's all interconnected. So we find that with the right homeopathic medicine, kind of everything can get better. And then a lot of the time, these other systems do need to be supported with, specific targeted nutrients or herbs that can just like promote faster healing. So I don't by any means use exclusively homeopathy. I love it and I use it with just about everybody, but there are many other amazing parts of naturopathic medicine that I always use too.
Nice. All right, Dr. Peyman, have you ever experienced cases that you were able to slowly help patients stop their pharmaceuticals or at least reduce them by using homeopathic remedies?
Absolutely. Yes, all the time.
Great.
I do that all the time.
Awesome. Okay.
I could talk for hours about many cases that I've worked with where people are able to taper their psychiatric medications because I mean, most of the time when people come to me, they're over medicated, to be honest. And their psychiatrist or their prescriber is just trying to tamp down the symptoms to the point where they're not having symptoms anymore, but then they're having side effects that are really sometimes intolerable of the high doses of the prescription medications. And in a lot of cases, these meds are like barely even working and they're just causing more side effects than benefits. So yeah, thankfully, with the addition of naturopathic medicine, and sometimes what I found is like they just need to have their medications changed, like if they're on super high dose, like for example, I had a patient who came to me with bipolar type 2 disorder. He was on 80 milligrams of fluoxetine, which is really high, like the highest dose that I've seen ever. Most people are on like 40. That's considered like a normal dose. So he's on 80 milligrams, still very depressed, like hopeless depressed. And he was on 1,000 milligrams of divalproex, which is Depakote, and super lethargic, like oversleeping, but also restless at night, poor quality sleep, and super depressed. And he was like hopeless about his health. Like he was like, I'm never getting better. I took his case. His daughter had responded really well to bupropion, which is Wellbutrin. And so I just tapered him down on the fluoxetine and added Wellbutrin and then tapered the divalproex to half. And I put him on a homeopathic remedy and I changed his multivitamin to a better quality vitamin so that he has like all the B vitamins and nutrients that his body needs for general health. I put him on some lithium orotate, which is good for depression. And he also has Parkinson's disease that's being managed by a neurologist. And there's some interesting research on antioxidant nutrients for Parkinson's disease. So we added that and some good quality fish oil, some vitamin D based on his labs. And he's just improved progressively over time. So he doesn't need, his medications are tapered. This is an example of like, he's not off meds, but he might be at some point. I've been working with him for a year now, and he's on like dramatically lower doses of medications than before. And importantly, he's better, so he's happy with it. And my goal isn't ever to just get everybody off meds. Like that's not wise, or like, who am I to say? Like it's their life, and so if they really want to be off meds, I'll advise them of whether I feel like that's appropriate for their case. And if I feel that it is, then I'll help them get to the lowest dose or get off. And I have had cases where we've absolutely done that. And in some cases, I'll advise them, please don't go off your medication because here's how it seems to have helped you. And I've seen it go really badly. I have patients come to me who have really severe mental illness, like very severe schizophrenia or something. And they're like, I want to be off all meds. And I'm like, please don't do that because it just ends up causing more disruption in their life almost every time. Only I can say there are a couple of like a small handful of cases where if I treat it very early before they ever go on meds. I have had a case that I'd be happy to share where he came to me when he was 17 years old, first episode of psychosis. He was starting to hear voices and have paranoia. And I started him on a remedy called anacardium, and he never needed to go on meds. All of his symptoms went away. He at one point like tried reducing the frequency of dosing and just like, maybe I don't need the anacardium anymore. And his symptoms started to kind of creep back a little bit. Like he was not all the way fully balanced without it. And so I don't know if he's taking it every single day. He's taking it like multiple times a week now. And he's like living his life. He's going to college. He's about to graduate, has a girlfriend, like everything's fine. So that's possible. But in most cases where it's like more advanced and they've been on a medication for a long time, then their brain isn't used to that. And so it's better to just get them down to the lowest necessary dose to keep things stable and just incorporate as much natural stuff as possible to help the brain and the nervous system and the body to be as healthy as possible. I've focused a lot more lately in gut healing because of the gut-brain connection, and just been really impressed with how focusing on gut healing and kind of correcting microbiome imbalances can dramatically improve mental health. And so that's something that I'm hopeful for more and more progress over time in terms of helping people to reduce the need for medication, because the body is going to be so much healthier if the gut is healthier.
That's actually kind of in line with one of the first questions. I think we might have skipped over a little bit, but all of this is just fascinating because especially
I know.
I'm loving this so much. Kaylin asked earlier, I'm so excited to hear you take on the mind-body connections when dealing with bipolar disorder. There are some diets they recommend for certain disorders. Is there one that you would recommend for bipolar? What's your approach to treating a manic state? And you mentioned kind of diet and nutrition.
Yeah, so in terms of diets, I'm very I am very individualized with that. Like, I don't put everybody on a specific diet. I think that it's really important to respect each individual person and, know where they're coming from. I know there's a lot of orthorexia, which I don't know if you guys are familiar with that term, but it's basically like hyper focus on health and nutrition to the point where it creates anxiety. And so I'm a big proponent of balance in all things. And so what I like to do is encourage people to eat real, natural food and figure out what really feels best for their body. Some people do best with a gluten-free diet. Some people do best with gluten-free and dairy-free. Some people do best with eating a little bit of everything, but everybody does better when they eat more natural foods and less processed food.
Right.
More omega-3s, more sort of lean protein. So if I had to pick like one diet, which I won't do, but if I had to pick something that like most people are going to generally do well on, it would probably be like the Mediterranean diet, or some version of that, maybe with a little less grains for some people or no grains for some people. But that's sort of the general gist of what most people do well on in my experience, because it's particularly good for mental health, but also autoimmunity, and like there's so much research behind it. In terms of mania, so that's a sort of a second part of this question, like how do I so manic episodes, it depends on the person. Like some manic episodes are extremely severe and like emergency level severe, and some manic episodes are hypomania or like mild mania, which are not an emergency situation, but it's just like problematic for the person. What I always like to say and teach my patients is that what goes up must come down. So some people, especially with bipolar type 2 or like mild mania or even severe mania, they feel so good when they're manic that they don't want help. They don't want treatment. And if it's really severe, there can be a disruption in the prefrontal cortex where the person has really impaired judgment. So they don't think that they're sick. They think they're perfectly fine. Everyone else is crazy. They're, amazing, and they're going to save the world, and they're, on a mission. And it can really be difficult if a person has that lack of awareness of their illness. So we always like to try to treat it early, and, with the concept that the quicker we can treat it, the more, and this is what I always tell people in terms of the what goes up must come down, that we want to treat the mania so that we prevent the depression, because nobody likes depression. So if we can prevent the person from using up all their energy, and, manic episodes are quite damaging to the brain. It's almost like having a long-term seizure. So it creates so much brain activity that it actually causes literal damage to the neurons. And then afterwards, the brain is completely wiped out and depleted. So the more we can prevent that and treat it early, the easier it'll be in terms of the come down. So I use a variety of things. Sometimes medication is necessary to help a person stabilize quickly. If it's milder, we can treat it with homeopathic medicine. That can actually be a very quick intervention where a person can stabilize fast. Like I had a recent case where she was taking medication already. She was on like olanzapine and lithium, I think, but she wasn't stabilizing. So those are very strong medications, and she was still having delusions, and I don't know if she was having hallucinations at this time. It was a little unclear. She wasn't really telling me, which happens a lot. with psychosis, where they just don't tell you what they're experiencing mentally, but you can kind of get a sense of it based on their behavior, like laughing spontaneously, or anyway. So she was like not sleeping. She was having a lot of psychotic symptoms and super high irritable energy and sort of misinterpreting things, getting irritable. And I gave her a homeopathic remedy called cannabis indica based on her symptoms. And so that's a homeopathic version of cannabis, which is very different from herbal cannabis. It has a completely opposite effect, in fact, where it can like calm a person down and reduce psychosis, whereas actual like herbal cannabis can induce psychosis in people who are susceptible to it. So with her, I mean, she's doing great. And she didn't change her prescription meds. We just added a homeopathic remedy. So that can be very beneficial. And then there's a few other things, but honestly, all of like the herbal things are, in my experience, kind of a drop in the bucket. When it comes to treating mania, I've used like melatonin, lithium orotate, valerian root, like super high doses of inositol, glycine, magnesium, like really trying to suppress these symptoms and like calm the person down, and just it doesn't do anything. The mania, and at least unless it's really mild, if it's hypomania, those actually absolutely work. But if it's full intense mania, the only thing I've actually seen work are prescriptions and homeopathy. So that's why I love homeopathy. I mean, there's many reasons, but it's so effective. Like as long as you find the right remedy, it's so effective for really clearing up these symptoms very efficiently.
Wow, that's fantastic.
I know. Could listen to you all day, Dr. Peyman.
I know. I know. I do want to keep going through the questions, but I'm afraid, like, I want to get like, all right, words of advice, anything in these last 4 minutes. Jody, did you see any other questions that we
This question here, I'd like to ask: once a patient heals from their illness, would they need to continue the homeopathy treatment to prevent the illness from coming back? So once they're on a homeopathy remedy, are they always on it?
No, not necessarily. Because the person actually heals themselves. So it's not the remedy that's causing the healing, it's the person responding to the remedy.
Right.
So it depends on the person and outside factors. But if in many cases, if they get to a place of like they're really better, then they're really better. It's not a cover up. In other words, it's like real healing. So it depends. I mean, there's a lot of outside factors, and sometimes people will continue to need some kind of treatment, but they don't necessarily have to stay on their remedy for forever. I noticed there was also a question in there about OCD. And
OCD, I was going to ask that.
Yeah, I treat a lot of OCD. It's one of my favorite things to treat, actually. And I do success with it. Yeah, it's tricky. In some cases, it doesn't get better like instantly. Like my bipolar cases and a lot of other cases tend to get better a little faster. In most cases, I have had one case of OCD where a little 11-year-old girl with very severe OCD, and just one remedy, Meterinum, for her, just she was like so much better. I mean, now she's done things change over time, but so much better. And so it's wonderful. And it didn't take a long time at all for her. It was like, within a week, it was much, much better. I've had other cases where it takes like a month for things to start to improve, and then it's a little stickier. So it's hard. I always recommend counseling for OCD, like exposure response prevention or ACT or other sort of interventions, because it's half behavioral, half kind of biological, physiological, psychological. It's like there's a lot of aspects, and so we need to treat all of those aspects in order for things to really heal. And then gut healing can be super important. There's a lot of connections between OCD and gut health. And I'll just say, I know in terms of like final words, I know we're running really short.
Yes, we're like in our last minute.
What I would say is, I mean, in terms of words of advice, I would highly recommend going back to what I was saying before of like finding what gives you that spark. Really pay attention to what's interesting to you, and then try to find your niche within, if you do practice naturopathic medicine or in anything in your life, really finding sort of what motivates you, what drives you, what gives you that sense of like, I love this, because your patients will feel that, and they'll sense like, this person is really, really passionate about what they're doing. They really care, and they'll feel like taken care of. You know, they'll feel like your passion is helping them. And that's really inspiring. So, and then you won't get burned out in whatever you're doing, because even if it's really hard, I've never felt like even one day in my practice, like, oh, I shouldn't have been doing this. I love what I
Okay.
do. I get to live what I love every day.
I
So
love it. I
it's,
love it.
yeah, an joy.
Awesome. Awesome.
Thank you
Awesome.
for this amazing hour. So generous of your time, such incredible information, truly fascinating. And I think you've helped me with my pitch on how I'll explain homeopathy.
Exactly.
to-
Mine too, after all these years.
Oh, so great to see you.
Awesome.
Such wonderful
Good to
information.
see you. Yes.
Thank you, everybody, for your great questions and joining us today as well. Next month, another amazing conversation. So keep an eye out for your invites. We'll see you there. Thank you, Dr.
Thanks,
Peyman.
Dr. Peyman. Have a great day.
Bye.
Bye.
Bye.